Okay. Hi, everyone. My name is Vaibhav. I'm a health tech entrepreneur and I'm the founder of Hippo.ai. As part of this hackathon, what we've built is we've built a pandemic management solution, which we're calling PanMan. And what we're essentially trying to do is give hospitals the ability to manage the COVID-19 pandemic through their hospital. So hospitals today are going to be constrained by four resources. One is they need to ensure better patient outcomes. They need to track their availability supply of beds. They need to be able to track the number of ventilators they have, and they also need to track the amount of PPE, so personal protection equipment they have. What we're trying to do is our first product aims at solving that. So without me talking more, let me directly get into the demo then. So let me look at a simple user flow. So in this case, what we've developed is an app that can be run on iOS and Android. It's already ready. Let's assume a patient called Vijay Reddy, who's 65 years of age, comes to a hospital and he comes with certain symptoms. So using a quick 10-second onboarding flow, the nurse in charge of the receptionist adds the patient to the list. And as you can see here, once they're added to the list, there is a quick way where the patient can be sent to the screening section. And once they're in screening, their sample is taken and sent to the lab. And when it takes around 24 hours for the sample to come, and during the time, the patient is moved to the suspected isolation ward. And once the sample comes back in, unfortunately, if it is COVID positive, then the user can be quickly moved to the confirmed isolation ward. Plus, we have also tracking the COVID-19 specific health status that can be assigned to a particular patient. So COVID-19 has multiple presentations, right, from asymptomatic all the way to ARDS and septic shock, etc. So we are allowing for an easy way for the hospital to track this. So let's assume this since it's 65, let's assume he already has hypertension and he is symptomatic with comorbidity. We are changing that state, and as you can see, it's updated system-wide, and anyone who accesses this patient will be able to see it. Now, let's assume that his condition worsens, he'll have to be moved to the ICU, and the user's health status also has to be updated to a much more severe case, let's say S5 in this case. As you can see, we did all of that in less than 10 seconds, and that's how quick this is. The other workflow is for tracking equipments. So let's assume Mr. Vijay Reddy, who is in the ICU, needs a ventilator now. So in this case, the nurse or the hospital or doctor opens up the patient's page and looks at equipment, and they can see that there are 13 ventilators in the system. They quickly assign a ventilator, and as you can see, the ventilator was assigned to this patient and the overall count went down. And we also allow the nurse or the staff in charge to track the amount of personal protection equipment that's available today. So in this case, let's assume that at the beginning of the shift, there was 30 left, they updated 30, and boom, this is updated everywhere. Now, how is all of this useful? This really is useful when the hospital administrator logs into the dashboard, and using a single pane of glass, they can get a complete view of what's going on in their hospital. They can understand that this is how the patients are flowing. They can understand which departments are where the demand is more than the supply. They can look at a single snapshot of all the PPE equipment. They can know when it's going to run out. And they can also see COVID-specific health details of its COVID-19 patients. This really becomes powerful when we are talking about an ecosystem. When we have multiple hospitals and the government using PanMan, we can have a system where the statistics flow upwards, the actions from the government flow downwards, and it also allows for inter-hospital transfer. It also allows for transfer of patients, critical patients from government hospitals to tier 2 or tier 3 private hospitals. So when we're looking at the roadmap, some things that really excite us, some things that we want to build are localized outbreak predictions. Today's predictions are all macro level, countrywide or citywide. Yeah. What we're trying to do is give a hospital the insight saying how many patients will come tomorrow. And along with that, we are also opening up PanMan as a platform. Anyone can use our data and build applications on top of it. So this is our team. We have a bunch of really awesome people, along with a bunch of medical advisors from AIIMS and from PeopleTree hospitals here. The asks is again is to allow us to scale this up, and for scaling it up, we will need funding. We need to set up a team of FTEs. And if there are any contacts in the government of Karnataka or any other state governments, I would need their help to get this implemented there and start trials and adoption by private chains as well. So with that said, we would love to talk more. Again, this is a prototype that we built in a week. We are going to expand this, and we need your help to do it. For any details, please visit panman.in.
Thank you.
Yeah,
I have one question that came up repeatedly.
sure.
Biju Jacob and I think Kshitij Jain asked, will this integrate into hospital information system, or does it have to be entered manually, the data?
If the hospital has a hospital information system, yes, it can be integrated, but the number of hospitals that have it in India are pretty low. So we have designed it as a standalone system.
Okay, okay. Thank you. I will
Yeah,
connect you to people who've asked this. Maybe they have more context which can be helped.